Hi, Dr. Pelto here. Today we're going to go over a condition called Charcot Foot. Basically, this is one of the worst things that can happen if you or a loved one have diabetes. So we're going to look at detail at some of the ways of treating Charcot and how to deal with it long term. I think you're going to enjoy this episode. So we're going to look over, I'm going to show a healthy foot here. You can see everything is in alignment here. And you can see a Charcot foot. So basically a Charcot foot, the way I like to explain it, is a foot that has collapsed. And you're basically walking on a broken foot. And you might be wondering, how in the world can someone walk on a foot like this? How can someone walk on a foot that's broken? It's because when someone has a Charcot foot, it usually means, I would say usually 99% of the time, they can't feel their foot. And so basically they're walking on a foot that's broken. Now, you might wonder why in the world this happens. Well, it happens because of something called diabetes and then also something that's called neuropathy. So let's look a little bit more at that today. So let's go here. We'll look at we'll go all the way back to the beginning here. We're going to go through some of these things. So when we're talking about Charcot foot, you can see there is neuropathy. Neuropathy in my practice tends to cause either diabetes, due to diabetes, or due to alcohol. Both of these can cause neuropathy. And there's a couple of different philosophies behind it, and I'll kind of explain them. One is when you have neuropathy, it can affect the nerve endings. And these nerve endings are used to control blood flow. And so there can be an increased amount of blood flow to the area because basically you have to have the nerve endings to close off the blood vessels. If that's not working, it's going to open up and it's going to increase and have a lot of blood flow. That's why someone with Charcot foot is going to have a very red hot swollen foot. Another thing that can cause it as well is trauma or an injury. So many times patients, they might step off the curb the wrong way. They might go for a little bit longer of a walk, have a little bit of a trip, and their foot just kind of balloons up. And very commonly people think that this is caused by an infection. And a lot of times it's not an infection. It's this problem called Charcot foot. So there's a couple of causes. I like to explain this idea with a dysfunction symptom index. So basically, if someone has age, their age right here, and as the age, you get older and older, when you get symptoms, now this can be any type of symptoms in your foot, but specifically diabetic symptoms. So let me give you an example. If someone has dysfunction, so one of the dysfunctions could be diabetes, right? That could cause dysfunction to the sweating on the bottom of the foot, of how the blood vessels work, things like that. They could also have a flat foot. They could be moving less or have tightness, or they could have a shoe that's the wrong type or some type of a foot deformity. What happens for a lot of people, they live their whole life and they don't really have any symptoms, okay? But if someone has an incident, so their age goes on and they have more dysfunction, let's say they start to have just diabetes, no problem. Diabetes causes poor blood flow and neuropathy. That could cause a spike. And so these types of incidences we see when they go on this symptom, right, up into the symptoms. This could be a diabetic foot ulcer, a cut in the skin. This could be an ingrown toenail. This could be Charcot. And so a lot of our patients, especially diabetics, they might start out with having maybe a wound. Then they could have another wound. And so when we see them in the office, they have the symptoms and then we'll treat them and have this go back down, maybe have another issue. And Charcot is one of these really big spikes that we like to deal with. So if you have Charcot, how does this affect you? Well, it's going to affect you. Usually you get frustrated. Why? We'll talk about it in a little bit, but you have to stay off your foot for like 6 months. If not, it could get a lot worse. You could have anger. You can't walk for exercise. You're really going to be off your foot. You're going to get fatter. You're going to have weight gain. There's going to be a fear of surgery, a fear of missing out on work, and then you can't be as active as you want. So these are all the problems with Charcot foot.